Welcome to Aging Together, a podcast dedicated to exploring the challenges and opportunities of caring for our aging loved ones. This podcast is a product of Caregiver Consulting and Healthy Solutions, a private consulting practice dedicated to helping you navigate the aging process with ease. Together, we will dive into a wide range of topics, including health and wellness, financial planning, caregiving, and more. This podcast is for everyone, whether you are an older adult looking to age in place, a caregiver seeking support and guidance, a young or middle-aged adult planning for the future, or simply someone interested in learning more about the aging process. I hope you'll join me on this journey. Let's navigate aging together. What's up, everyone? I'm your host, Pooja, and you're listening to Aging Together. Happy June! Summertime Chicago has been in full swing the past couple weeks, and it has definitely been a treat for us. June brings us to Alzheimer's and Brain Awareness Month, National Family Month, Pride Month, and PTSD Awareness Month. In today's episode, I'm taking a dive into Alzheimer's and Brain Awareness Month, specifically cognitive health and aging. Alzheimer's and Brain Awareness Month provides an excellent opportunity to shed light on the importance of cognitive health in aging adults. As our population continues to age, understanding the factors influencing cognitive decline and implementing strategies to maintain or manage brain health becomes increasingly crucial. Cognitive decline can be a natural part of aging, but it can also be a source of concern for both older adults and their loved ones. By understanding the factors that contribute to cognitive decline and implementing strategies to manage it, we can help older adults maintain their cognitive function and quality of life. In this guide, we will explore the process of aging, discuss common brain health illnesses in older adults, examine factors impacting cognitive and brain health, explore options for care, and finally, provide actionable ways to prevent cognitive decline and strategies to maintain optimal cognitive health. First up, let's define age-related and non-age-related cognitive decline. Aging is a natural biological process characterized by a gradual decline in physical and cognitive functions. While it is normal for certain cognitive abilities, such as processing speed and working memory, to decline with age, significant cognitive impairments are not an inevitable consequence of aging. Cognitive decline specifically refers to a decline in cognitive function, which includes memory, language, and problem-solving skills. Cognitive decline can be a normal part of aging, or it can be a result of conditions such as Alzheimer's disease or other forms of dementia. Next, let's define dementia. Dementia is an umbrella term that covers decline in any cognitive function, such as memory, attention, problem-solving, and judgment. Dementia itself is not a diagnosis, but rather an umbrella term for all types of cognitive impairment. Dementia can be reversible or irreversible. Reversible dementias are often short-lived and are often due to an underlying cause that causes changes in cognitive functions and which are likely to resolve once the underlying cause has been addressed. An example of this is a common side effect of having a urinary tract infection as you get older is confusion. And in most cases, that confusion resolves once the urinary tract infection has been addressed and is improving. When most people hear or talk about dementia, it's often about irreversible dementias, such as Alzheimer's disease, which brings me to the 4 most common brain health illnesses in older adults, which are all irreversible dementias: Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. Alzheimer's disease is the most common form of dementia, accounting for around 60 to 80% of cases. It is characterized by the progressive loss of cognitive abilities, including memory, thinking, and reasoning skills. Early symptoms may include forgetfulness and difficulty finding words, while later stages involve severe cognitive impairment and the need for extensive care. Vascular dementia occurs when there is damage to the brain's blood vessels, often due to a stroke or other vascular conditions. It can lead to memory loss, confusion, and difficulty with decision-making and planning. Lewy body dementia is characterized by abnormal protein deposits called Lewy bodies in the brain. It can cause a range of cognitive and behavioral symptoms, including fluctuating attention and alertness, visual hallucinations, and motor symptoms that may look similar to Parkinson's disease. And frontotemporal dementia primarily affects the frontal and temporal lobes of the brain, leading to changes in personality, behavior, and language abilities. Memory problems may not be prominent in the earlier stages of frontotemporal dementia. Let's talk about factors impacting cognitive and brain health in aging. I've broken them down into two areas, genetic and lifestyle. For genetic factors, certain genes, such as the APOE4 gene, increases the risk of developing Alzheimer's disease. However, having these genes does not guarantee that an individual will definitely develop the condition. Lifestyle factors include physical exercise, healthy diet, mental stimulation, social engagement, sleep, and management of chronic conditions. Regular physical exercise has been linked to better cognitive function and a reduced risk of cognitive decline. Engaging in activities such as walking, swimming, or dancing improves blood flow to the brain, stimulating the release of growth factors and promotes neuroplasticity, which is our brain's way of reorganizing how our brain works. Consuming a balanced diet that is rich in fruits, vegetables, whole grains, lean proteins, and healthy fats provides essential nutrients for brain health. The Mediterranean diet, in particular, has been associated with a lower risk of cognitive decline. Engaging in intellectually stimulating activities such as reading, puzzles, learning new skills, or playing musical instruments helps keep the brain active and promotes cognitive reserve. Maintaining social connections and participating in social activities has been linked to a reduced risk of cognitive decline. Social interaction provides cognitive stimulation, emotional support, and a sense of purpose. Sufficient sleep is vital for cognitive health, as it allows the brain to consolidate memories and repair itself. Poor sleep quality or inadequate sleep duration can impair cognitive function. And finally, managing chronic conditions such as diabetes, high blood pressure, and obesity is crucial for brain health, as these conditions increase the risk of cognitive decline and dementia. Now, you or a family member may have already been diagnosed, and you may be wondering what your options for care are. I'm going to break them down into two categories, medical and non-medical. Medical interventions are treatments like medications and clinical trials. There are certain medications that can help manage the symptoms of Alzheimer's disease, although they do not halt or cure the underlying disease. These medications may temporarily improve cognitive function and reduce behavioral symptoms. Medications used in cases of dementia are primarily to help manage symptoms and not the disease itself. Clinical trials offer an opportunity to contribute to research and potentially access innovative treatments or interventions. Non-medical interventions are treatments like therapy, emotional support, and assistive technologies. For one, cognitive stimulation is a very important type of therapy. Engaging in cognitive activities such as puzzles, memory games, or computer-based programs can help maintain cognitive function and slow down cognitive decline. You may be able to work with an occupational therapist or a speech-language pathologist to better understand your cognitive needs and strategies or activities to help improve or manage them. Check out last week's episode where I spoke with a speech-language pathologist about their role in cognition. Providing emotional support to individuals with cognitive decline is essential. Support groups and counseling services can help patients and their families cope with the challenges associated with cognitive impairment. There are various assistive technologies, such as reminder systems, GPS trackers, and medication management apps that can enhance independence and safety for individuals with cognitive impairments. Stay tuned for our very first live fireside chat regarding home modifications and treatment strategies for older adults with cognitive decline and their families later this month. Although dementia may seem inevitable, it's not. And here are some strategies for preventing cognitive decline and maintaining good cognitive health as you age. 1. Adopting healthy lifestyle habits. You want to engage in regular physical exercise, follow a balanced diet emphasizing brain-healthy foods, stay mentally active by challenging the brain with puzzles, reading, or learning new skills, maintain social connections and engage in meaningful social activities, and prioritize quality sleep and establish a consistent sleep routine. 2. Manage chronic conditions. It's very important to address any underlying health conditions that may contribute to cognitive decline. This may involve taking medications as prescribed or making lifestyle changes such as exercising regularly or following a healthy diet. You want to regularly monitor and manage chronic conditions such as diabetes, high blood pressure, and obesity. And it's important to follow any prescribed medication and treatment plans. 3. Stay mentally and socially engaged. One of the most effective strategies is to engage in mentally stimulating activities. This could include activities such as reading, crossword puzzles, or participating in discussion groups. Studies have shown that mentally stimulating activities can help to maintain cognitive function and even improve it in some cases. Another important aspect of managing cognitive decline is to provide social support and encourage social engagement. Studies have shown that social connections are important for maintaining cognitive function and can help to reduce the risk of cognitive decline. It's recommended and encouraged to pursue hobbies and interests that stimulate the mind, volunteer or engage in community activities, and maintain strong social connections with friends and family. And 4, regular health checkups. It's important to recognize that managing cognitive decline is a continuous process. It's important to stay informed about resources and technologies that may be useful in maintaining cognitive function and to be open to trying new strategies as needed. You want to stay up to date with preventative health screenings and immunizations, and consult healthcare professionals if any cognitive changes or concerns arise. Better yet, see if you can start participating in early detection testing and treatment options. You can see your primary care doctor, a neuropsychologist, an occupational therapist, or a speech-language pathologist. They can take you through various screenings and tests to see if there are any early warning signs you may be able to start addressing before they get worse. As we celebrate Alzheimer's and Brain Awareness Month, it is crucial to recognize the significance of cognitive health for aging adults. By understanding the process of aging, the common brain health illnesses in older adults, the factors impacting cognitive and brain health, and available options for care, we can work towards promoting and maintaining optimal cognitive function. Cognitive decline is, again, a natural part of aging, but there are strategies that can help to manage it. By engaging in mentally stimulating activities, addressing underlying health conditions, and providing social support, we can help older adults maintain their cognitive function and quality of life. By adopting a healthy lifestyle, managing chronic conditions, staying mentally and socially engaged, and seeking regular health checkups, individuals can take proactive steps to prevent cognitive decline and safeguard their cognitive health well into their later years. At Caregiver Consulting and Healthy Solutions, we are dedicated to helping you navigate aging together. Thanks for tuning in, and I'll see you next time.